All right, good morning, everyone. Thanks for joining Groundwork Ohio's morning meeting today. I am going to share a very quick where we're at in the state budget process before we dive in, because I want to give as much time as possible to our wonderful speakers this morning. So many of you may have seen that the budget now has a bill number. So we're looking at House Bill 96 this year, and it was just released on Tuesday evening. So we have language attached to what the governor's proposals are that were introduced last week. So our team is still reviewing that language in more detail, and we can anticipate a substitute version of the bill in the coming weeks, possibly as early as next week from the House. That will be their first round of changes that they make to what the governor has proposed. So we will keep you posted on that. We have been hearing that there are possibilities for public testimony at the end of this month. So looking at perhaps February 25th, 26th, possibly for public testimony related to some of our content areas in the Children and Human Services House Committee. And more to come on the Finance Committee notices as well. So we'll send that out over email. We'll continue sharing those dates once they're more concrete on these calls as well. And we'll do our best to activate everybody. But if you have questions as things go, you know how to get a hold of all of us. And without further ado, I really want to introduce Amy Reigel and Al Jenkins. We're so excited to have them here today. Many of you know my background before my groundwork life was in the affordable housing space. So I've had the pleasure of working with Amy over the years. And I'll just give a little background on her work before I pitch it over to her. So Amy, before coming to COHHIO as their executive director in 2022, was with CareSource, which is obviously a managed care organization serving over 2 million people in 6 states. And at CareSource, she was the director of housing, building collaborative partnerships to address affordable housing through development, financing, and policy with an emphasis on innovation. At CareSource, she initiated and led the strategic investment of $50 million of affordable housing across multiple states and helped launch and replicate Healthy Beginnings at Home, which we will talk much more about today. And that is a nationally recognized research study that looks at the relationship between housing and healthy birth outcomes for moms and babies. So really excited to dive into that more. Amy's depth of experience in community development is just unparalleled, and we're so lucky to have her working in this space alongside us. And she lives in Dayton, so she commutes back and forth here with her husband and 3 daughters. And I am so pleased that I get to work in the same building as her and pop into her in the elevator before meetings like this. So good morning, Amy, and I'll read Al's bio before we pass it over to him here from First Year CLE shortly. But please feel free to take it over, Amy.
Yes, thank you, Brittany. And so I think I'm here today to give kind of like the professorial overview of Healthy Beginnings at Home. And then Al's going to do the real work and tell you about how it's actually happening on the ground and the great work that actually happens in communities, which is really the heart and soul of the work of Healthy Beginnings at Home. And so, just to give a little bit of background, so Healthy Beginnings at Home has actually been around in some form since about 2015. It was actually a brainchild of Reverend John Edgar, who works in the south side of Columbus. And he was saying, we have these women who are coming in to our facility and they're looking for social services. They're pregnant. And the one thing that we see in their pregnancies is for the women who have housing instability, that they're not having as healthy of babies as the women who we know are stably housed. And it was just kind of this feeling like if we were to provide more stability to pregnant women, we think these babies would be healthier. And so back in 2015, they were able to secure a grant through the CareSource Foundation, and they were able to house 10 women. And of those 10 women, they were all housed during their pregnancy. The women all gave birth to live babies, and of those babies, um, 9 of them were healthy birth weight and full term. One baby was like 2 grams below a healthy birth weight. So very close, but just right below that line that we used to cut off. And all of them were still thriving at their first birthday. And as they talked to the women said, it really made a difference to have this housing and to know that my housing was taken care of for not only my pregnancy, but for that first year after my pregnancy. And so Reverend Edgar helped many others within the community to continue to push this forward and to really elevate the idea that there is this link between stable housing and healthy birth outcomes. We all know the social determinants of health, health related social needs are core to so many health outcomes. And this was one where if we were to not just focus on those very important things that happen during a pregnancy and after pregnancy in the doctor's office, but also focus on the home and the basis for the stability of the women and the children, then maybe we would be able to do better. So in 2018, Healthy Beginnings at Home was replicated in Columbus, Ohio, in a controlled research study. It was 50 women in the control group, 50 women in the intervention group, and they looked at the differences in outcomes. It was a feasibility study to say, is there really stickiness here? Is there really something we should be looking at? And the feasibility study was positive in saying, yes, there are trends that say we should take this further. And so, in that, the women who were in the intervention group were 60% less likely to have babies that required neonatal intensive care time. And for the women who did have babies that required neonatal intensive care time or NICU time, they spent 75% less time in NICU. Also, there were no fetal losses in the intervention group, whereas there were 4 fetal losses in the control group. As we took the data out further, we found that there were extreme savings also to Medicaid, not just by the woman who had the baby, not just by the baby itself that was born during this time, but also to every member of the household. Most of the women had other children already in their household, and most of them had another loving, caring adult who was living in the household with them. It really varied who that loving, caring adult was in the household. In some cases, it was a sister. In some cases, it was a mom, a grandma, a spouse, or a male partner. But there was someone else. We really saw the savings with that. With that other adult in the household, there was significant savings also. So overall, it showed that there was a great health benefit to the baby, significant, but then to everyone in the household. So from that, we have been working to replicate Healthy Beginnings at Home across the state, especially in high infant mortality areas. So the work has spread to Akron, to Cleveland and First Year Cleveland, and also to Dayton, working with the Greater Dayton Area Hospital Association to implement the next iteration. What we have to really underscore is that there's no magic sauce that is the implementation of Healthy Beginnings at Home. There's not some fancy case management that we're doing, although the case managers are all fabulous and all wonderful. It is not necessarily the way we intake or some assessment that we're doing. It is this connection between housing stability and and the medical outcomes of the situation. That it is the housing stability, it's the ability to get into that housing, to know that you can afford the housing, and then to know you can stay in the housing that is really the key, we believe, to this work. And so, as we talk about replication, a lot of people can get really stuck in the, well, I have to do healthy beginnings at home. And what we're really trying to help all understand at the local, state, and federal level that it's really about addressing this crisis that we have within housing for childbearing women and young families. That is really what we need to address. And as long as we have this housing crisis where eviction is a word that children learn before the age of 5, that we will continue to have these negative health outcomes. And so, how do we think about this from the standpoint of a state budget, a federal budget, a Medicaid budget, a local budget? How do we think about these dollars and really helping to get them out into community and infusing them to the families who need them the most? And so I think I'll stop there and and turn it over to Al unless there's any questions or anything else you want me to add, Brittany.
No, Amy, that was the perfect overview. Thank you so much. And we have greatly appreciated partnering with you in advocacy around this program specifically, but just agree that as much as we can direct resources to the connection between housing and healthy birth outcomes, all the better. And really looking forward to hearing an update from Al on exactly what they're doing in Cleveland. Are there questions for Amy before we transition to more of a local snapshot of the program at work? Okay, keep those questions rolling. I think Amy's willing to stick around for the rest of the meeting. So if you think of something as Al's talking that generates some questions for Amy or vice versa, we can open it up at the end. So I'm going to turn it over to Al as he gets his slides up. I'm very excited to share his bio. He is a dynamic healthcare project management professional with experience in the public health space related to quality improvement, strategic program development, and he has his bachelor's from Miami University in public health. And I didn't know that you were also currently working on your MBA as well on top of all of this, Al. My goodness. So he currently serves as a project manager at First Year Cleveland, overseeing grant-funded initiatives that are really aimed at improving maternal health outcomes and facilitating strategic collaborations among community organizations in Cuyahoga County. His expertise in quality and performance improvement was further honed during his tenure at the Better Health Partnership, where he managed data-driven healthcare initiatives, grant-funded programs, and community-based interventions to improve population health outcomes. We are so excited to have you here today. We really appreciate partnering with First Year Cleveland whenever we have maternal and infant health work to tackle at the State House, and really looking forward to your presentation. Thanks, Al.
Thanks, Brittany, and thank you, Amy, for kicking it off here. So, at first, I want to shout out to our local partners here who are making Healthy Beginnings at Home here in Cuyahoga County possible. So, First Year Cleveland, we're overseeing the project, but the Centers for Family and Children are serving as our housing service agency. So, they have two housing stability specialists or case managers. With one clinical supervisor overseeing the work with the participants as well. And we're gracious to have Eden, who is serving the role of our housing locator and rental housing assistance manager. So they're identifying those affordable quality rental units that meet the HQS standards, passing those inspections, but also has a relationship with property owners in the community as well. So they've been a great partner in this. And we're also lucky to have CMHA, our local housing authority, who has committed housing vouchers to the Healthy Beginnings at Home participants, which is a pretty big deal for the program. And then lastly, Neighborhood Leadership Institute, who is our centralized screening entity for the eligibility determination for Healthy Beginnings at Home participants. So kind of taking a localized context of what Amy has went over, why Healthy Beginnings at Home is needed, especially throughout the state of Ohio, but here in Cuyahoga County. So you guys may know the data around the racial disparities in infant mortality. No matter what years you're looking at or 3-year or 5-year average, it's always between 2 to 3 times more likely that a Black baby is going to die than a white baby. That is a needle that we've been trying to improve over the past, decade plus. And that's something we're continuing to hone in on. And we think that this housing portion could be a really big part of this. To give more context here, this year, the fair market rent in the Cleveland area is over $1,200 a month for a 2-bedroom. That is astronomical thinking about the wages that people are making nowadays. And you see the federal poverty line in Ohio is just under $26,000 for a family of 3. And to add on to that, the city of Cleveland has an overall poverty rate of 30.8%, which is the second highest in the United States for a big city. So we see that housing is a really big problem here, and the affordability of housing is one of the major players also of housing availability being another problem. So locally here, we began enrolling participants in Health Begins at Home in August of 2024. And currently we have 18 families enrolled, which is great. We've committed to serving 30 in the project here in Cuyahoga County. We have 10 currently housed. So they're all doing well, currently housed, and we've had 6 births so far. So we're off to a good start here. But the major impact here, I think, that is key for our participants is families get 2 years of assistance with their rent and work with a community health worker or a case manager to address other needs for the household. And I have a plethora of needs listed here. I think you guys are familiar with it, focusing on transportation, potentially job applications, getting health appointments scheduled and transportation to those health appointments, addressing those needs. Trauma support. There's a lot of families have gone through a lot of trauma and have not gone through any of the trauma support or potentially any counseling to handle that. Along with the case management, there's a lot of financial counseling going on that is built into the program. There's a lot of evidence base built into the case management of this program, which is nice. It's like Amy said, it's nothing fancy. It's what case managers always do. They want to make sure that families are set up to be successful. And then there's a sustainability planning portion to this as well. Since this is only a 2-year program, the goal is to have these families be self-sufficient toward the end. And I know we've gotten questions of, okay, what if they're not self-sufficient by the end of the program? We have different mechanisms and way to continue to pass the family on to other programs or have other programs potentially set up for them to continue to get the help that they need. But the goal is to hopefully they become self-sufficient, but also have healthy birth outcomes. That is the goal. And utilizing health beginnings at home to support policy improvement and investments that reduce infant mortality and improve birth and health outcomes. So these are some of our main goals that we have for the future. One of those being having pregnant individuals added to the priority population for housing choice voucher programs. I think that is a major one that can easily be done and be added, right? You think about pregnant individuals are bringing in the next generation, right? But they're not prioritized when it comes to housing. So I think that is a win that we can all work towards here. But we can also work towards having additional state and national investment. For example, House Bill 7, I know there's been a lot of budget, meetings and things of that nature around House Bill 7. But House Bill 7 is a part of Healthy Beginnings at Home. And I know that in the budget, there's additional funding that maybe could be had for Healthy Beginnings at Home, but there's different meetings. And that is something that First Year Cleveland as an organization and other organizations around the state have been coming together to advocate for this investment. And then lastly, we want to use Health Begins at Home to basically set up a framework to create a sustainable housing program locally and then hopefully statewide, as we are in other major cities in Ohio with the program. So utilizing the framework, getting together with local organizations, philanthropy, to try to come up with our own housing program for more sustainable, affordable housing for those families in need. No, that was a quick overview, but thank you, Brittany, for having me on, and thank you, Amy, for teeing it up.
Thank you so much, Al. And you ended on the exact note that I know our folks are going to be interested in, which is how we can try to advance this program and additional investment and prioritization at the State House this cycle. So, Al and Amy both, while folks are thinking of additional questions, I would just love to get your thoughts on um, what the appetite looks like for, advancing this program. Is not in the current version of the budget bill, but are there ways that we can try to advocate for it as a standalone bill, as an amendment, or if you have thoughts on legislators that our folks should be reaching out to. Our advocacy day is March 12th, and this will absolutely come up in our meetings that day.
Yes. So this program, interesting, has In the last budget bill, it was actually introduced at a budget of $19 million, and Healthy Beginnings at Home ended up receiving 2.5 million of that introduced amount. And as we worked through that process last time, the feedback was interesting because people got hung up on different things that never had to do with the actual core of the project. Oh, we don't want to fund research. Oh, we want it to be here. We want it to be there. We want it to do this. We want it to do that. We want it to be longer. We want it to serve more people as a way of like giving it less money. But it was never the issue of helping to reduce health expenditures by housing people was never one of the reasons. And so that's been some of the difficulty is that people get hung up on what it's not or what is kind of moldable rather than the actual goal of the program itself. We have great champions out there. Representative Andrea White has been an incredible champion of the program. We also see great champions come out kind of in other ways, not necessarily of Healthy Beginnings at Home, but of other family-friendly programs. Senator Michelle Reynolds and her housing plan has been incredibly supportive of families, including um, uh, supporting the establishment of an eviction representation program that would focus on women in eviction court who have small young children. Senator Craig has been incredibly supportive. There's numerous from the Democratic side, I will say we've had overwhelming support for the program without a doubt. So we see that there is strong support. It is it's just kind of finding that way in of how we actually get funding for it. The other thing that I have to emphasize is we are not in the game of taking away someone else's money. And that's kind of what we're often pitted against. It's like, well, if you want money, then we're going to take it from this group over here and we're going to take it from your friend over there. That is not our goal. Our goal is to make the pie bigger, not to steal someone else's piece of pie. And so really focusing on that and not saying, I'm not going to bash someone else's program to fund another one. Not the name of the game and not what's going to help our women and children across the state.
Mhm.
And so helping to really pursue that also.
I love that point, Amy. And it's so funny. I was just at Julie's conference last week with the Ohio Head Start Association, and that was one of the questions that came up during our advocacy conversation. And one of the strategies that we use is really to just politely put it back on the legislators that it's their job to make those choices. That's why they're there. And I am never going to disparage another program for the sake of something that we support, because we know we need all of these social determinants of health addressed in order to make families strong, and lots of different partners need to be leading in those ways. So thank you for those insights. And a lot of those legislators that you mentioned, it's no surprise, have been supportive of all sorts of different family related investments. Did anyone else have a question? I could keep going, but I don't want to monopolize their time. Okay, we do have a few minutes left. So Al, I would love to ask you, I know you showed a really robust list of local partners that have been integral in bringing the program to life. Can you share like how long did it take to bring, I would imagine it was a cumbersome process to bring that many folks to the table, and get the right people in the right seats. Can you share a little bit about how long that took or any tips or strategies about making that collaboration work?
Yeah, so with our partners, we being kind of a community movement, we are well versed in our community. So a lot of the partners we've already had existing relationships with and done work with them in the past. So it was kind of easy to go to them and basically pitch this idea. They're all have the same feelings of us, like we're trying to get these families housed. We all are in agreement there that the people in need, we need to get them housed. So it wasn't like a hard sell to any of our organizations, but Health Beginnings had a great framework that we went over with them, and they were agreed on, to be on board. So I would say that process, from contracts and all of that stuff, a few months, just so everything was being figured out. I know during that time there were things in the budget we are waiting to hear back, like Amy said, around, how much of the budget we were going to receive, and it was ultimately, that 2.5 overall budget. So once we got that news, we knew what, we were going to be working with and the amount of families that we will be serving. So
That's really helpful to hear. I'm curious about this is similar language to one of the items that we have in our policy agenda this cycle, but prioritizing pregnant individuals in the Housing Choice Voucher Program. Do either of you have thoughts on strategies for advancing that? Is that a federal change? Is that a state level change that could be made? Is that something OFA does or development? Where would that decision be made?
I'm not sure, Amy, you may be, but I'm pretty sure that's like a HUD definition, right?
Hmm.
Each of the public housing authorities do get the ability to create priority populations because every jurisdiction is different and different jurisdictions can have different needs. So at it is allowable currently. However, there isn't necessarily a federal model that comes that makes it easy to just like plug and play. If you think about the prioritization that's been given to veterans through the VASH program, not only are they getting the prioritization for the voucher, but then also receiving those supportive services and the wraparound case management that is essential. And it would be great. That has been a very successful program. It has done tremendous work to reduce overall veterans homeless across the United States. If we could have a similar program to that, what we know is not only would we help these women today, but if a child does not experience homelessness before they reach adulthood, their likelihood of ever experiencing homelessness almost becomes unknown. So we would have a long-term longitudinal impact of that investment today.
Feels like a no-brainer to all of us. Thanks, Amy. Well, we've got just a couple minutes left. If anybody would like to come off mute, feel free. We can keep this very informal. Or if you're a chat person, I'm happy to read out loud for you. Okay. Okay, maybe a question more for Al. I love hearing about the program in Cleveland. Are there also connections being made with resources like SNAP or WIC or nutritional education? I assume the answer is yes, since you have CHWs doing community health workers doing some of the work. Are there resource referrals for the women enrolled in the program to other services like SNAP and WIC?
Yes, that is all a part of the case management process. So for participants to be enrolled in the program, they do have to be, a part of the case management process. So a lot of that is getting connected to those resources. One of the eligibility criteria is they have to be on Medicaid. So that is one of those things. So obviously
Mhm.
connection to SNAP and other benefits that kind of go along with that will be made.
Excellent. Thank you. And great question. Hi, Angela.
Can I mention something real quick?
Of course you can.
So first, let me acknowledge Al and how amazing he is and all the great work he's been doing. Overseeing the success that we're having with our local Healthy Beginnings at Home project. But I also wanted to add to that. So First Year Cleveland, because we do a lot of fundraising and have support from our local foundations and city county government, it allows us to have some flexibility on what investments we make and acknowledging that, housing is such a great concern. In this past, we call them community investment grants. We were able to provide some support to to an organization that's providing housing to women. So trying to address infrastructure needs to serve the families or the women that they're housing, but then also providing emergency rental assistance to some of our other partners. And so, trying to find creative ways to offset, the burden that a lot of our local organizations are feeling when trying to make sure that, they can support their families. And so, I'm a huge fan of Healthy Beginnings at Home, and any evidence, not that we need it, that we can use to justify how important stable housing is, not just for birth outcomes, but just overall health and well-being in general. It's just a great opportunity. So I think we're going to have a comprehensive and very creative approach to this statewide. And I just look forward to partnering with all of you, and especially Groundwork. And we'll be joining you in the next couple of weeks for your Advocacy Day. Um,
Yay.
to continue the conversation, because we too, with our Infant Vitality Advocacy Day, housing is one of our priorities as well. So just working with partners across the state to keep engaging. And as Amy mentioned, Senator Reynolds is a huge advocate, and she did host a whole housing forum here, and she's actually coming in a couple weeks, I think, or maybe in March, to the City Club here in Cleveland. So if any of you all are in the Cleveland area, I encourage you to stop on in, or you can stream it live. But that's all.
That's amazing. Thank you, Angela. And I am not remotely surprised that you're finding other creative ways to get in there and make those connections and investments. We just are always amazed when we hear about the new things that you're doing up there. And really excited to have you on the ground here on March 12th. Thanks for the plug. I'll just put the link in the chat. It's free to attend. Please join us on March 12th for Advocacy Day, and we can chat with all of our legislators about the importance of connecting pregnant parents to housing options. So thank you, Al, Amy, First Year Cleveland, COHHIO. We are so grateful for your partnership and for the work that you do, and just really appreciate you sharing time with us this morning. We'll get Al's slides out here within the next few days, and we'll see everybody next Thursday at 9:30 a.m. Have a wonderful day. Thank you.